feel like I'm in the way of the slides, but I guess you can see okay.
Right, there we go. Something just happened.
Good morning. Come on in. We were just about to get started.
So here.
Wonderful. All right. Well, good morning, everyone. We will get started. I appreciate you spending your morning with me. And to those of you virtually, thank you for joining us, enjoying your cup of coffee, wherever you may be. My name is Heather Walrath. I am an accredited financial counselor. I'm also an accredited veterans representative. I think most important hat that I wear, though, military spouse. So my husband retired about 2.5 years ago. So we have made it to the next chapter pretty successfully, right? But a lot of lessons learned. I am part, let me move on here, of Navy Mutual Aid Association. So hopefully you have heard of us. We're actually the oldest federally recognized veteran service organization in the country, which is a great thing to be a part of. We still are a nonprofit life insurance agency or organization. We're not an agency, we're a nonprofit. We serve all branches. I am privileged to be part of the other side of the house, education and veteran services. So my job is doing personal finance education and then also helping folks apply for their VA benefits and also working with survivors. So that's why we have the pleasure of being with you all today. So what I wanted to talk about is a lot of the misconceptions around VA benefits. Unfortunately, we get to the point where a lot of people say, nobody ever told me, or they had a different understanding of what the benefits actually are. So let's kind of talk about what the VA is, right? When I have conversations with veterans and spouses, they always say, they told me. And my question is, who is they, right? Because the VA is a big organization. So we have 3 parts of the VA house, okay? So you have the benefits administration, which is where you're getting your VA disability compensation checks, education benefits, things like that. We have the healthcare administration, and that's where you're going to the clinics to get the healthcare services, the long-term care services. Good morning. Good morning. Great. And then we have the cemetery administration. So there are 3 different parts of the VA. Do you think that they have seamless communication with each other? Of course not, right? Good morning. Come on in. So understand that even if you are being seen at the clinic for a certain condition, they are not communicating that information to the benefit side of the house in terms of an increase for your rating or anything like that. Okay, so understanding that you might need to take a little bit of action to kind of promote that conversation to get those records transferred is really important. Also, don't forget that states have benefits as well. So we tend to think about VA as the big federal agency where we're getting our benefits, but the reality is states do things on their own as well. Okay, so depending which state you live in, there might be additional benefits. So all states have state level agencies that you can talk to regarding veteran benefits. Yes, ma'am. Do you have a question?
Are the states benefits different economic?
Yes. Mm-hmm. Yes, absolutely. So different states have different benefits. For example, in Virginia, if the veteran is at least 90% as their combined rating, their dependents get free education benefits from the state, but not all states do that. Okay, so that's what's important.
Just add that 90% permanent total.
Yes, permanent total.
Permanent total, 90 to 100%. If the program's called EMS, And what they do is you apply for that, you get free tuition. And if the veteran is also, we'll probably get to it later, but if you're eligible for another scholarship and from the VA, that's a federal benefit, it's called Chapter 35, say, then if you can combine those two to get something very close to a post 9/11 GI Bill benefit for your family.
Right. So that's Virginia, right? And other states do things differently, but it's a great program. It's 8 semesters of tuition that is covered for a spouse and eligible children. So again, you're going to have to look, I'll be honest, I can't keep up with all 50 states, right? But as you move around, leave no stone unturned. The other thing that is fairly common, property tax exemptions, based on your disability rating. So make sure you are taking advantage of those types of benefits. All right, so let's start here. I get this question a lot. Let me see what you think. The VA will compensate me for my pain and suffering.
No.
That was a very fast answer.
Well,
I appreciate that enthusiasm.
Actually, I have to tell you who I am. I'm the North Regional Director for the Virginia Department of Veterans.
Oh, great. No,
I run
great.
the benefits.
Perfect. Well, thank you for what you're doing. I appreciate that. But you're right. We get this a lot, right? This misunderstanding of how these benefits work. So let's dive a little bit deeper into some other misconceptions that we get about applying for benefits. Okay, that maybe keep people from taking that step of things that they're entitled to. So sometimes people say, oh, I didn't serve long enough. I was only in 5 years, 10 years. That doesn't matter. Okay, your length of service has no bearing on whether or not you're eligible for benefits. There's nothing wrong with me. Okay, well, that term, right, wrong, has lots of different meanings. And I will tell you that, yes, I am sure that there is another veteran out there that has worse conditions than you. But that doesn't minimize your conditions, right? That doesn't minimize what you are dealing with as a result of your service. So don't let that scare you away, thinking that someone else is worse off. In most cases, you can still continue to work and collect your VA disability compensation. Okay. You will still get your full service retirement. We'll talk, there could be some offsets, but you're not going to get less money, essentially, by applying for the VA. Okay. And it doesn't matter how long you have been separated from service. If you have a condition, right, that you think is resulting from your service or made worse by your service, apply. My father-in-law was a Marine veteran, been out 30 years and just got an increase for a condition that he has. Okay. So we're going to talk a little bit more about these things, but these are some of the common things that I see that are preventing people from getting the benefits that they deserve. So what can be claimed? Again, there's no time limit on how long you have to claim these conditions. But when you came into service, there was a presumption that you had sound body and mind. And remember when you went through all your physicals, right? So now we want to address, how has service changed that? How has it caused the condition that you currently have? Or how has it made an existing you had prior to coming in worse? So that's what we're trying to do, is connecting that. Now, if you really want to geek out and get into the VA law, you peel back all those layers of onions, right? That there's a lot there. It isn't about compensating you for your pain and suffering. Okay? Really, it is about, how does your condition result in a reduced earnings capacity? That's what the law is about. Okay. Now, that being said, we all know veterans that are 100% P&T, permanent and total, that maybe are earning 6-figure incomes, right? But I can guarantee you, from working with veterans, they are dealing with things, right? Maybe disabilities that are not visible to you, but a lot of anxiety, PTSD, mental health, and disabilities that aren't visible. Okay, so understand that it doesn't mean you cannot work. Okay, but the VA is compensating you for those conditions that you're having to deal with. So things to think about. Now, we want to focus on a condition, not an exposure. And that's often the misconception, especially with the PACT Act. And we're not going to have time to dive a lot into the PACT Act today, but people will call and say, okay, I was exposed to a burn pit. What's my rating? You don't get a rating for being exposed, you get a rating for having a condition. Okay, so some of these things that we see, exposure to Agent Orange, the cancer diagnosis, right? Again, burn pit exposure, but do you have asthma, chronic sinusitis, all these, breathing, pulmonary issues? Okay, you still have to have a condition there. And sometimes I'll get the question with COVID, right? Well, I had COVID when I was on active duty. Do you have any residual effects from COVID? No, I'm fine. Everything's good. Okay, well, then we're not going to claim that as a condition. Now, at the current time, right? Now, things could change, right? Things might manifest later, like what happened with my father-in-law, but we're talking about a current condition. Now, I would also encourage you to work with a VSO, the Veteran Service Organization, an accredited veterans representative. These folks have been recognized by the VA as having the skills, the experience to be able to assist you with the claim. They do not charge you. So big red flag, if someone's trying to charge you for your initial claim, they are not accredited. All right, so that's a huge thing to watch out for, and we deal with that in the space. The claim sharks, right, that are trying to go after those vulnerable veterans. So reach out. Again, Navy Mutual is an accredited veterans organization. We're actually the oldest federally recognized veterans service organization. So reach out if we can help you at any point, navigating some of this. So this is just kind of a look at what we're talking about in terms of the compensation. Now, this typically changes every year. If you are rated at least 30%, you get additional compensation for having dependents. Now, the dependents don't get a check, okay? Your spouse does not get a check. You get additional compensation on your award because you are supporting people, right? So that goes back to the whole reduced earnings capacity. In theory, if you have reduced earnings capacity, you should get a little bit more because there's people relying on you for support. I just like this chart. I want to point out here that, people think, 60, 70%, it's about the same. It's really not, right, in terms of the compensation that you get. So I would say if you have a rating, but you feel like you have additional conditions that are not reflected in that rating, or maybe you included a condition and that condition has worsened, it certainly could be to your benefit to go back and have that reevaluated, to apply for an increase or to file a claim for an additional condition, okay? Because there are other benefits that could come into play aside from just a little bit more compensation. So typically these rates adjust every year, right, with the annual cost of living increase. And it's important to keep the VA up to date on your dependents. Yes, ma'am.
Can I add something?
Sure.
I'm Tina Caston. I'm a chapter service officer for the State of American Veterans. Something else that we forget at 30%, we get reimbursed for trips to medical appointments. We get reimbursed for trips to, even if they send you outside the base or the VA, you can still get reimbursed for it. It's an online app, okay? Reimbursement for medical travel.
So for those of you in our virtual land, don't forget that if you're at least 30%, thanks for the reminder, Tina, that you get compensation for travel to your medical appointments that you can file. So yeah, thanks for bringing that up. A lot of benefits out there. So how about this one? Have you all heard this from your friends, your family, other veterans? My VA disability will continue for my spouse after my death. And he's shaking his head. No, right? So let's dive into that a little bit. No, your VA disability compensation ends when you die. No more for your family. Now, there is a benefit called dependency indemnity compensation, DIC for short. And that is a flat rate stipend that is available for a survivor if the service member died on active duty, or if they died from a service-connected condition, or if they were at that 100% P&T rating for a certain amount of time, right? So you see all these ors, okay? They could apply to different situations. Now, it is a lifetime benefit for a spouse, okay? So if that spouse lives to be 110, they're getting this money for the rest of their life, unless they remarry before age 55. Okay, and then at that point, the benefit is suspended. Okay, now they could get it back if that marriage ends. And this is always a hot topic for a lot of lobbying organizations for veterans benefits to try to get that part changed. But that's how the law currently is. There's also a stipend for eligible children, which is typically up until 18, 23 if they're in school, unless you have a child that is helpless. And that's the term that the VA uses, but typically that means incapable of self-support. All right, but that is a flat rate benefit. Doesn't have to do with how much did the veteran get, it has to do with how much Congress authorizes every year for this benefit. Now, I get this misunderstanding a lot from people when I'm assisting with the financial planning component, right? And we're talking about income sources. And they'll tell me, oh, well, you can put down DIC because I'm sure my spouse is going to have that. Why are you sure your spouse is going to have that? Oh, because I am 100% P&T. And my next question is, how long have you been 100%? Oh, 2 years. No, come back and talk to me in 3 more years. Okay, because how this works is if your initial rating, going back to separation, was 100%, you have to stay at that 100% for at least 5 years for your family to get that DIC benefit regardless of the cause of death. Okay, so let's say 2 years in, you die in a car accident. Okay, well, that wasn't service connected, right? And you haven't been at that 100% for at least 5 years, no benefit. Okay. Now, you die in a car accident 6 years, benefit applies because you've hit that 5-year mark. Now, remember though, you don't have to be at 100%. Maybe you're at 40%. But maybe one of the conditions that you're rated for is hypertension, high blood pressure, and you die of a heart attack. Then maybe we can make that service connection piece happen and the benefit would apply. Okay. Now let's say that you've been out a few years and you go and you apply for new conditions or you apply for an increase and you get to 100%. At that point, you have to have been there 10 years, okay, for the benefit to apply regardless of the cause of death. So you can see how this gets a little bit confusing, right, in terms of our families with estate planning and these survivorship type things, okay, because the reality is most spouses are not going to get DIC. And if they do, it is most likely a reduction. So here's an example of while the veteran was alive, they were at that 100% rating, and that's about $4,000 a month. They die, the spouse is eligible for that DIC benefit, but it's only $1,653 currently. So we're talking about a $2,400 difference for your family. Okay, so expectation management, right? That's important. I also get this one a lot. You guys heard this? I served 20 years, so I get a pension from the VA and it continues for my spouse. These are different benefits. Now, for a service member that serves at least 20 years, you get a pension from your service, right? From DOD, your Coast Guard, from Homeland Security, you got that pension. This is a different pension. There is a pension from the VA, but it has very different criteria, okay? And it doesn't really have to do anything with numbers of years of service. So let's dive into that a little bit. So the veteran and survivor pension is available for qualifying veterans and their spouses who meet certain wartime service periods and who have certain income limits, net worth limits. So this is typically for very low income veterans. Okay, this has nothing to do with you served 20 years. This has to do with your income is really below the poverty line, essentially. And there's qualifiers for this. So they're looking at your assets, your income, any type of retirement pension that you get, any kind of disability benefits that you get, that counts as your income in terms of qualifying for this. They also have a 3-year look back when you go to apply for this benefit. So unfortunately, if your plan is, I'm just going to transfer the house to my daughter for $1 so that way, I can qualify for these VA benefits, that's going to bar you. If you have done a transfer like that for less than the value of the assets within 3 years, that bars you for 5 years from getting any of these benefits. So I think that's important to understand as well, in terms of what you might be eligible for and what that might mean in terms of estate planning and legacy type things. Questions or comments? All right, I like that you're shaking your head yes when I'm saying things. I'm feeling confident here. All right. Here is the amount of that pension. Okay, and this is an annual amount, right? So we're not talking about a lot of money coming from the VA to support you, right? So, there's different levels. We're not going to dive too deep into these housebound or aid in attendance, but those benefits are additional benefits that a veteran or a survivor can get on top of their award if they are housebound or if they need certain types of long-term care that we'll talk about. So just the pension itself, is about $1,700 for the veteran and about, $17,000 for the veteran and about $11,000 for the spouse. So this is not a significant source of income. It would be really difficult. And the other thing I want to point out is this is a flat rate no matter where you live. Okay, so if you are choosing to stay here in Washington, D.C., that money is not going to go as far as if you want to go down and live with my mom in Georgia. Okay, so that's the important part here to understand that there's no cost of living increase added to this if you choose to live in San Diego. Okay, flat rate benefits. All right, so we kind of alluded to some benefits from the state level, but unfortunately I get this phone call as well. Hey, I am 100% P&T, so my family gets free school. You're shaking your head over there, right? Not exactly the case, right? So let's dive into that one a little bit. So there is a program called Dependents Education Assistance. Really, the program is now called Survivors and Dependents Education Assistance. DEA for short, it's Chapter 35 of the U.S. Code. And this provides a stipend for eligible family members if the veteran is rated 100% P&T or if the veteran died of a service-connected condition. But what is unique about this benefit, as opposed to DIC, where the veteran has to have passed away, this one they can use while the veteran is still alive. Now, it's 36 months of qualified education expenses for each eligible child and the spouse. Whereas the GI Bill, you've got that one benefit that could be split. This is each person gets the benefit. Now, it is a flat rate. Are you catching the trend here at the VA? All these things are flat rates, right? Right now, I think I've got the next slide for that. Full-time enrollment is $1,536. So if you as a spouse or if your child is enrolled in an accredited institution, they can get that flat rate benefit. However, it's probably not going to cover everything, right? So that is not free school, but that is a stipend for them to use. It gets paid directly to that beneficiary. Now, the other thing that I think is really important about this is that it does make the school, if it's a state school, charge you in-state tuition. So even though it may not cover everything, it could bring that number down quite a bit. Okay, so my son is out in Montana State University. Don't ask me how he got out there. It's because he wanted to do stuff with cows. There's a lot of cows out there. Okay, but he is using some veteran benefits, thanks to my husband. And he doesn't have enough to get him through 4 years, but that gives him in-state tuition. Okay, now in-state tuition, Montana State, about $8,000 a year.
Mhm.
Out-of-state tuition is $31,000 a year, right? So there would be no way that we could afford him to be living his best life as a cowboy in Montana without these veteran benefits. Okay, because if he was to use DEA, that brings it down to the in-state tuition. Okay, and again, as a gentleman shared with us, states might also have benefits as well, and you can use both. Typically, it depends on the state how they stack them. Sometimes you can use them at the same time. Sometimes it has to be used differently depending on the state. But do not overlook those state benefits. Okay, I've been able to use the education benefit in the state of Virginia. Okay, I'm all about taking all of the benefits that I can. Okay, so very extraordinary benefits that could be available, but you're not getting free school in most cases, at least from big VA, right? Okay, so now we're getting a little deeper into some more significant long-term type thinking. And I would also challenge you to think about this with a different hat on if you have aging parents who are veterans. Okay, because unfortunately, so many veterans make the assumption that the VA is going to take care of them as they age. So, have that conversation with your parents. So let's talk a little bit about VA and long-term care. So it is important for a veteran to be enrolled in VA healthcare. Remember at the beginning when I talked about the 3 different parts of the VA house? So you have a rating. That doesn't mean you can just walk into the VA and get care. Now, of course, if you have a service-connected condition, you can always be seen at the VA for free for those conditions, but you still have to enroll in VA healthcare. Okay, so that's one piece of this. Anyone to have any eligibility for long-term care, oops, it tells me I'm talking too slow. If you want to have eligibility for long-term care, you have to be enrolled in VA healthcare. The second piece is the VA has to agree that you need the care. So they could have a different assessment. And then finally, there has to be service available. So maybe, you live 2 blocks from a premier VA long-term care facility, but they have no beds. Maybe you are living your best life out at Montana, and the closest VA facility is 2 hours away. They don't have a requirement to bring it to your house. Okay, so you can see how there's a lot of variables in terms of eligibility, right? And I want to point out, very rarely are there going to be any benefits for spouses. Okay, so even if the veteran gets some benefits, probably not the spouse, unless they get that aid in attendance, which also has income requirements and things like that. Some states, well, we'll move on. We'll talk about this in a second. But what I'm talking about here is for the VA long-term care are access to services. And they can come in many different forms. They're starting to partner a lot more with community organizations. Why are my slides moving so fast? I'm not ready. So it can come in lots of different forms, okay? These benefits are always changing and evolving. Okay, I personally think the VA does a great job. Sometimes they get a bad rap, but we've had excellent care and services with the VA. But remember, as laws change, as accessibility changes, this might open more doors for you and for other veterans. But the studies do say that about 70% of us are going to need some sort of long-term care. So how are you going to pay for that? Okay. So, let's talk about what might be out there. When people say, I'm going to go to a VA home, do you realize there's only 2 federal homes? Okay, and this is for our enlisted personnel. So there is one here in Washington, D.C., the Soldiers and Sailors Home. It has a different name now, but over by Basilica, very beautiful campus, a really great place to visit. There's also a veteran cemetery there. It's another beautiful experience to go over there. The other one is, anybody know where? The other,
Texas. One time.
Gulfport, Mississippi. Okay, not a good place to be this time of year, right? I don't want to be in Mississippi, right? I told you I'm from Georgia. I know how hot it is, right? But that is where the 2 homes are. Okay. Now, when you say veterans homes, what you're probably thinking about is a state veterans home. Okay, because again, going back to the state benefits, many states operate homes and services for the veteran. Again, different criteria for being eligible, but a lot of times you can use those big federal VA funds or qualifiers for programs at these state facilities. Okay, but really when we're talking about federal, just 2 and for our enlisted members. Okay, so that leaves part of the population without that type of care. The other thing I think is important to note about these 2 federal VA homes, you have to be able to live independently to be accepted initially. Okay, now once you get in, if your care needs change, then they have access to you for other programs. But initially, you have to be able to live independently. So if you get to the point where you wait until you really need the long-term care, this program might not even be accessible to you.
All the way up to hospice?
I think so. Well, and hospice is a separate program. So yes, because long-term care does not typically include hospice. That's something different that people would be eligible for regardless. Mm-hmm. But you do pay to live there. So again, VA is not going to take care of you. Now, how much it costs you is a percentage of your monthly gross income. And it does cap, for this year, it caps for that higher level memory support, we're talking about $8,100. But that is still a lot of money, right? That they're going to take from the veteran to provide these services. So we're not talking about free benefits, even if you do qualify. Okay, and I would say benefits that you're going to qualify for the VA are not going to provide all the care that you need in most cases. But we do have these state veterans homes. There's 2 in Virginia, is that correct? Right? 2, they're building another one?
The 3rd one is built, the governor, before he leaves office, is working to get that one. That's the one in Fairfield County.
Okay. That's what I was thinking about. Yeah. And then there's 2 in Maryland as well. And when you consider the sizable veteran population that we have here in Northern Virginia, that's not a lot of facilities, right? And we worked a long time to get that 3rd one in Virginia going. Okay. So again, you look with your states. States are going to have different criteria as to who can live in their homes. All right. Residency requirements. Right, that you were a Virginia resident for a certain amount of time. Some states don't. I know, for example, New York, they will take any veteran. Doesn't matter if you never lived in the state of New York. But again, space available, right? If your plan is when the time comes to move to New York, they might have changed the policy at that point. Okay, but the residency requirements could vary from state to state.
Don't forget about the nonprofits that are actually.
Absolutely.
Yeah, so I think it's important that you have nonprofit organizations. I think they're trying to another one in Fairfield County, but it's more like tiny homes for veterans and trying to do like a campus for those and build out that, and then kind of taking the concept and moving across.
Yeah, so the comment was, don't forget about nonprofits that also are operating homes for veterans, usually in a smaller capacity type setting, group homes, community centers. And again, the VA is doing a lot of work in this space, recognizing the aging veteran population to try to use some of these community programs and make them more accessible and funded. So those are some changes that we're definitely seeing.
and also I think some of the programs like AARP program like state, now that you've shown the cost, but now as you age, the emphasis is maybe you want to be able to stay in your home with modifications so that
Yeah.
you're able to stay in your home longer, an area that you know, and it's actually far cheaper than
Mhm.
than a occupant. But
AARP provides grants.
That's it.
Yep,
So
so,
this is VA. And VA, if you're eligible for that. Yeah.
yep, so the comments in the room are about, again, these local programs, partnerships, programs through AARP that provide grants, and really more of an emphasis. A lot of those programs are aging at home, right? Being able to live at your home residence with aid and support. So again, it continues to evolve. So it's definitely something that is being worked on. Guys heard this one? I get free life insurance from the VA. Okay. And we get this a lot again at Navy Mutual because we provide life insurance, right? And we'll have conversations about, are you properly insured? Oh, yeah, because I got it from the VA. Do you? Okay. So let's talk a little bit about, maybe where those misconceptions are coming from and, what benefits actually are available with the VA. So when a service member leaves and they have had SGLI, that's a service member group life insurance, there are opportunities for them to convert that to other life insurance without medical underwriting. Okay, so remember, when you apply for life insurance, there's usually that medical underwriting component, right? They want to know what medications you take, what conditions you have. And then based on how you answer those questionnaires, they might send you for a physical, do lab work and that type of thing to decide if they will cover you and how much it costs. Now, I get this question from veterans. Will my VA disability rating affect my ability to get life insurance? What do you think in the room?
Yeah.
I'm seeing some no's, some yeses. Well, in my opinion, your rating, no, because that's between you and the VA.
That's right.
You don't have to tell anybody your VA disability rating, okay? However, the underlying conditions that led to your rating could potentially affect things, right? Now, that being said, not everything, right? Maybe you got a bad back, you got a bad knee from your service, and you have a rating for that, okay? But life insurance companies typically don't care about that because it doesn't affect your mortality, right? But other conditions you have ratings for, potentially mental health, anxiety, PTSD, high blood pressure, could. I always tell people, please don't assume a condition you have is going to affect that. But if you do find that you have a condition that makes it difficult for you to get life insurance as you're transitioning, you have the opportunity to get other policies. One is VGLI, Veterans Group Life Insurance. The other option is to get a commercial whole life policy through 11 participating providers. Now, I will say about that, there's some other companies out there as well that will convert that are not on that list. At Navy Mutual, we will convert that for veterans as well within that 120 days. So you do need to do your due diligence and shop around a little bit. Okay, ask the question. I have SGLI. Is there anything that you would give me without having to medically qualify?
Say, to get a partial whole life policy.
Mm-hmm.
I actually don't know what that is.
Okay, so the question is, I mentioned a commercial whole life policy. When you're reading in the VA literature, it says you can convert your SGLI to a commercial policy. It's usually what it says, but all of those policies are whole life. Okay, so there's two main types of insurance. Term, X number of years, 10, 20, 30 years, you're locked in rates, and then it goes away. Whole life is a little bit different. How long does it last? Your whole entire life, right? Assuming you keep up with applicable premiums, right? So guaranteed payout, because you will pass away, right? I hope it's another 40 years, okay? So different types of insurance, but because of that guaranteed benefit and also that guaranteed payout and also some other features, maybe it has some cash value accrual, some chronic illness riders, meaning if you got sick, you could use a portion of that for care. It costs a lot more. Okay, so that's the main difference here when we're talking about a service member had their SGLI for $30. If they want $500,000 of whole life, average $400 a month. Okay, so different kinds of policy. But a veteran also has the option to get VGLI, which is Veterans Group Life Insurance, and that's a term policy. Basically a 5-year term, every 5 years the price goes up. Okay, so there is insurance available for veterans, but it is not free. Okay, there are costs associated with that. VGLI gets very expensive as you get older. Okay, if you're 80 years old and you're still paying for your VGLI coverage, $500,000, how much you paying right now? I know it just went down. Hey, that was the good news, right?
It's a lot.
$2,200 a month
Wow.
at age 80.
It's still more than the dollars.
Mm-hmm.
Way more than the-
So again, just some awareness because so many folks, I do a lot of work in that transition space. So many people think, oh, I'll just transfer my SGLI to VGLI, $30 a month, right? Gets older or gets higher as we get older. Okay. So just a little bit of misconceptions there. Oh, here's the rates. I was making you guess. I had it right there. I remember. But you see, so if a veteran is retiring at 45, it's $95 a month. I mean, it's not terrible, right? Things happen to us as we hit our 40s, 50s. But there you go. At age 80, if you still want this policy, you're paying $2,200 a month. Okay, so in terms of planning for our veterans, maybe VGLI is not your best option, but who would this be an amazing option for? Who would want to take VGLI?
Uninsured.
Yes, if you're uninsurable. And unfortunately, I've had members retiring with cancer, right? They're not going to get other insurance, but they can get this. So it is a benefit. Is it the best option? You've got to decide, based on your situation. Also, if you have this, you can always cancel it, or reduce it later on. And I tend to be more of a fan of reducing it because a lot of people say, well, I got insurance with my job now, right? But what happens when you leave that job? It goes away, right? So having some level of coverage that's independent from your employer would be helpful, right? So outside of these programs. Let's see how we doing on time. Now you might have heard something, a little myth about if you're disabled, you get an extension on your SGLI. Okay, and I think a lot of our audience is probably outside this extension window, but the important thing to remember is this is not just about being rated 100% PNT, because I get that call, right? Okay, I got my rating in. I'm 100% PNT, so I get 2 free years of SGLI, an extension of my SGLI. Well, no, I have to go to the questionnaire. Do you have permanent loss of both hands, both eyes, both feet, loss of hearing in both ears? No, but I'm 100%. Well, you don't qualify for this extension. Okay, it's very specific disabilities that allow that service member 2 more years of SGLI coverage for free. Okay, and it's only 2 years. Okay, and that 2-year window starts from when they left service, not from when they get their rating. So if it took them 4 months to get their rating, and it's retroactive to when they left, it's still only 2 years from when they left service, not from when they actually got the rating. In the weeds a little bit there, but just an understanding. And this just kind of goes over that timeline. This is a great chart from the VA, so thank you. Explaining how that works, a good visual representation. At that point, they still have the option to convert to VGLI, the Veterans Group Life Insurance. But the takeaway is it is not free and permanent, right? So that extension is not permanent, okay? Now, there is a new program relatively, now that we're in 2025, but in 2023, the VA revamped their life insurance programs a little bit and introduced something called the VA Life Program. Again, it is not free. This is a whole life program, okay, that is available to any veteran with a service-connected condition. So you do have to have gone through that rating process to get a service connection. Keep in mind that a rating of 0 is still a service connection. Okay, it's just saying that, yes, we agree that this condition is a result of your service, but at this point in time, it is not affecting you in such a way that it's compensable. Okay, but you still have a rating, so this would apply. There is a 2-year waiting period for this. So you sign up, the policy would not pay out to your beneficiary for 2 years. But if you pass away in that 2 years, your beneficiary can get a refund of those premiums that was paid in. It's not a lot of coverage. The most you can get is $40,000. Okay. The rates are based on your age, but they do stay locked in. They do not jump like the VGLI rates do. So this could be something important for someone that is uninsurable, at least to have a burial policy to prevent their families from having to incur that cost. Okay. What is the average cost of a burial?
15, based on state.
It depends. Yes, ma'am. It depends where you live. Average across the country, $10,000. Okay. So again, in terms of an estate planning perspective, these are things that we want to think about. There is no longer the service disabled veterans insurance. So if you happen to have it, you're not cut off. You still continue to have it. But enrollments for this ended in 2023 when they came out with the new VA Life program. So this is where a lot of that confusion comes from too, with the free VA life insurance, because when this was in effect, you could get $10,000 of insurance for free, but that is no longer available anymore. So sometimes people have conversations with veterans that have this program, assume that's now going to be available for them, and it no longer is. Does your family get health care from the VA?
No.
Hardly ever. There's always exceptions, right? But VA is about the veteran. Okay, VA healthcare is about taking care of our veterans. So there are 8 different priority levels in the VA for healthcare. Where you fall and which priority level depends on many things. Your rating, predominantly, your overall combined rating, could be your income, right? So 8 different levels. Now, remember again, separate program. Okay, so I want everybody to enroll in VA healthcare. Retirees can use the VA and TRICARE. Okay, you can absolutely use both. Why would you want to?
Because there are not a lot of doctors available to try care for life.
100%. There's not always availability. And remember, if your condition is service connected, the VA pays for whatever you need. So, for example, let's take sleep apnea. That's something that many of us have, right? While you're on active duty, of course, everything is paid for with your machine, your supplies. Once you retire, TRICARE will cover that, but there's a copay, right? With TRICARE, at least until you get to TRICARE for life, right? If you go to the VA and it's been service connected, you get all those supplies for free through VA healthcare. Mental health. Okay, we have found mental health services much more accessible from the VA because yes, you could use TRICARE, but to her point, there's not a lot of providers that are taking new patients or new clients, or they're even taking TRICARE. So VA, that might be something that you utilize that program for. So you can absolutely use both. There is a program called CHAMP VA, and that is available to family members, but it's a very small window of eligibility, essentially. Not window, but criteria, very narrow criteria. So if your family is eligible for TRICARE, they cannot use this CHAMP VA program, okay? If we have a veteran that is rated 100% P&T, doesn't have TRICARE, their family is eligible for CHAMP VA. Or if we have a case where a veteran died, again, from a service-connected condition, the family doesn't have TRICARE, they can use the CHAMP VA. Okay, so most people are not going to have that eligibility, and there's a lot of misconceptions about that as well. Did you all know that you can use the dental insurance through the VA if you're signed up for VA healthcare. Okay. So if your employer doesn't offer dental or it's expensive, there is a program on VA dental insurance, but you have to be signed up for VA healthcare. So that can provide access to dental insurance. Okay. All right. Yes, sir.
One question you might have covered, I might have missed it, but also vision would be if you're 100%.
Yeah. And again, we go back to the different priority levels. So if you're at least 50% in your combined rating, you're in the highest tier. You're in priority 1, and then you can pretty much be seen at the VA for anything, right? And that will include the vision and all of that.
But it does not include them.
Correct. Not dental.
Yes.
Yeah.
And hearing.
Yeah. So they can assist with things. But again, if you're not at 50%, you might be in a lower priority level. You can always be seen at the VA for any of those service-connected conditions. You might be able to use the VA for other things, but you could have a cost share, a copay to be seen. There could be income restrictions for certain things. So again, it kind of depends on, the veterans, your ratings, income, and things like that. Okay, did that answer your question? Okay, perfect. Okay, so let's just round this out with what happens when you're dead, right? We've come full circle now. All right. Now, you're a veteran. Our office at Navy Mutual, we are located on Joint Base Myers-Henderson Hall. Beautiful facility that overlooks Arlington National Cemetery. So that is a sobering reminder of what we do every day in serving that veteran community, right? And I see funerals going through all the time. But do veterans get all of their burial covered for free? They do not. Now, let's just back up a little bit. If, God forbid, a service member dies on active duty, yes, the service covers that. There's no cost. But the day you leave active duty, you're a veteran, you have benefits, but it's not going to pay 100% for you to be buried. Okay, so even if you decide to be buried in a VA cemetery, yes, you get the space in the ground, you get the headstone, you get the care of the site. We're not talking about a funeral, right? The funeral home, transportation costs, there are additional costs, okay? So understanding that is important. Also knowing that Arlington is not a VA cemetery. It's actually a Department of the Army cemetery. So they have slightly different criteria in terms of who can be buried there. For those of you that are here, you see all the construction going around, right? Kind of bummed because the Air Force Memorial was one of my favorite places to go and sit and see all the city and listen to the conference or the concerts that's been under construction for years now, right? But eventually they're going to open up, that's the last section of Arlington, okay, around the Air Force Memorial. So at that point, we're going to be at capacity before too long, so we'll have to look for other places. But again, look to the states. Okay, states have veteran cemeteries. VA, that's the third wing of the house, right, that maintains those programs. And here are some examples of what you get. In Virginia?
Yes, there's another national cemetery.
Quantico? Quantico, yes.
So, yes, Quantico is a national cemetery. And to your point, yes, there are state veteran cemeteries. And actually they have one in, it's from Dakota.
Okay.
It's a
Yeah, so we're talking about the different state versus federal VA cemeteries. Yes, sir?
Could you talk a little bit about how to apply? Because
Yes, absolutely. So thanks for bringing that up. I think that's a segue here. Yep, we'll get there in a second. So there is a VA burial allowance, okay, that many people don't realize. But again, VA is not covering everything. But this is something that your family can apply for to reimburse them for some burial expenses. The amount is going to depend again on that service connection, okay? If it's a service-connected death, you get $2,000, okay? Still, probably not going to cover everything. If it's a non-service connected death, you can still apply for a stipend, but it's under $1,000 in current law, okay? Remember, again, though, it's all about the service connection. So they have to have filed with the VA, have some service connection on file. 0 is a service connection.
Yes.
Okay. But unfortunately, if a veteran never got in the system essentially and passed away and the family tries to apply, there could be roadblocks because they don't have a service connected condition going back and trying to get that. So again, yes, there's a burial allowance, but no, it is not going to cover all of the costs to bury a veteran.
In Florida, you have to have a long form death certificate. Is that standard around the country? Yeah, in Florida, you have to have a long form and it has to list
The service connection.
disability or all deaths are off.
Mm-hmm. Right. And, you know, to Donald's question too, how do you apply essentially? So if you intend to be buried in a VA cemetery, I highly encourage you to go ahead and fill out the paperwork because that's one less thing that your family will have to do. Okay, because again, you have to provide documentation. So you can do the form 40-10007, okay, just to make it look complicated for us, right? And that is the application for pre-need determination of eligibility. Okay, so what that does is you provide everything they need, like your DD 214, which is your golden ticket to many of these things, right? Your VA records, right, in some cases, depending. But that basically, the VA will have that on file that when the time comes and your family contacts a veteran cemetery, you already have proven that you are eligible to be buried there based on your service. Okay, now, it does not reserve your place. Okay, so you can't say, I want to be buried, you know, in Quantico, whenever the day comes. No, all it says is you have eligibility. You have to see what space is available when the time comes. Okay, if there's no space at where you preferred, then you might have to go to another veteran cemetery. But this is one less thing your family is going to have to do. So you can already make sure that that is in place. Okay.
I learned, and I was surprised that if a spouse precedes the veteran, that spouse could be buried.
Yes, absolutely.
And that wiped me out. I mean, I just didn't connect it.
And that's a very good point. And you can do that as well. Just remember there's no burial allowance for a spouse. So yes, you get the space, you know, at the cemetery, the care of the site, but there's no burial allowance for a spouse or for a dependent child. Dependent child could also be buried there as well. Okay. But the key word is dependent. If your 50-year-old daughter, you know, passes away, they're not going to be able to be buried there. So that was not a dependent child unless, you know, they were helpless, right? So again, we're rounding it out. Don't forget about your states. Okay, a lot of different benefits. In Virginia, again, if you're 100%, you get property tax exemptions. Okay, and considering how much we pay in property taxes, that can be a huge thing. Also, personal property tax for the veteran, again, 100%, they don't pay that on one vehicle. Okay, so again, significant savings. Okay, yes, sir.
And are reduced on the second.
Yes, thank you. Reduced on the second one. Of course, it kind of depends on whose name everything is titled in, right? That's why, you know, from a financial planning perspective, I do it wrong because everything's in my husband's name. But that's because we got all the benefits like the VA loan, all the car exemptions and things, right? So don't forget about the states. Free hunting and fishing licenses. Okay, a lot of different benefits that could be available.
Yeah.
So go to that state. National parks, yes. That's kind of a bummer. I don't get one anymore. But if my husband goes with me, now we have the Veterans Pass, right? So a lot of great benefits. So leave no stone unturned with what you're eligible for.
We get free parking at the airport.
What?
What?
I didn't hear about that one.
License plate.
That's Jacksonville.
Florida.
Man, okay. But see, that's a good point because I was getting excited thinking here in Virginia, but it's just in Florida, right? So you got to check. And most states have a page, a web page for veteran services for that state. So go to the state, you know, stop by the office, see what else that you are eligible for. Okay, because there's a lot of things beyond big VA. Okay. So questions, comments? Do you have anything in the chat over there? No, just because we answered everything while we were talking, right? Yes, sir.
So, do you talk about, one-on-one services that you can provide?
Gonna get there, absolutely. Yeah, any other questions? Yes.
But what are, I guess, like the two sites might recommend to these benefits, the VA benefits,
Where to go to see the benefits? Yes, I 100% say va.gov.
Oh.
Okay, because if you just Google VA benefits, you're going to get 27,000 different sites that probably have not been updated for 10 years. So best place is va.gov for updates, and then the state sites as well for what they have with the state. But understand that policies change, and sometimes executive order happens and it doesn't get updated on the website right away. But usually that's going to be the most updated sites to do that. So just be careful where you're getting your information. I'm on a lot of different social media platforms, and questions, misconceptions, you're chuckling over there, right? People, I'm like, where did you hear that? And they'll send me a screenshot of chat GPT right here, because chat GPT told me. I'm like, yeah, that's completely wrong. Chat GPT didn't interpret that correctly, right? And remember, it's pulling from different things, so if there's incorrect information. So that's why I'm saying go to the regulations, right? All of this is based on law. Okay, so you can get your regulations, the policies, and all of that. But again, we are here to help. Okay, so Navy Mutual, oldest federally recognized veteran service organization. There's never a charge for us to help veterans. So applying for your benefits, for survivors applying for benefits, we also have accredited financial counselors. I'm a military qualified financial planner, and we have a program, Chart Your Path. Okay, so you can call, do a one-on-one with us about any financial topic, about how to integrate your benefits, make sure you're prepared for transition. We can have those conversations. Okay, so put us in your toolkit. Interestingly enough, we get random phone calls, and I'll say, how'd you hear about us? Oh, I called DFAS, and they didn't know the answer, so they said call you. I got you, right? DFAS should know the answer, but I got you. Same thing sometimes, I call VA, they say call you. We got you. Okay, so put a tool in your toolkit for services. Yes, sir.
Yeah, so to enroll in VA, that doesn't dictate that the TCM.
Correct. Yeah, it's an option for you to be able to use VA healthcare, but if you prefer not to, you don't have any requirement to do so.
In Virginia, the one-stop shop is the Virginia Veterans Network. So what we've done is created a website to you and where you kind of go. So it's a very easy enrollment, but if you kind of go in there, it talks all the service lines, but what they're trying to do is create that, because to your point, there's a lot of information out there and different websites that you'd have to go to try to get all that. So Virginia has worked very hard for the last 2 years to put that in one house and make it a one-stop shop for veterans. So that's
And the comment was the Virginia VVB, right? I have it bookmarked on there. Yeah, Virginia Veterans Network in the state of Virginia, great resource. Like you said, they worked really hard to put everything that's current and updated, lots of resources there. So that's the state of Virginia. Again, look to your state. So I can't emphasize enough going to those legitimate websites for the states as well to get that information. But Virginia does a great job.
That's on the VA.gov will point you to those state sites. Is that correct?
That's it?
No.
Yeah.
You'd have to go to your own individual state.
Yeah.
But right now, I think the best thing from all 50 is VBN, where everything's housed right there. So if you want to know about VA something or other, go to the VBN. So regardless of what state you're in, you can do that. And I'll tell you that in all states are a little different. But I help veterans from if the policy is if the state touches Virginia, you can help. So we've been helping folks all, as in a lot in Maryland. The Maryland state or sister organization, not as robust. So they kind of come across the phone to get help.
And for the folks at home, that's VBN. VBN.
Victor November.
VictorVictorNovember.org or .com?
That would-
.org. VVN.org. Yeah, again, I have it bookmarked, but then having to say it, I was like, what is it again?
Victor November.
Victor November. And thanks for reminding us about that. Yeah. Yes, ma'am.
Do you have any insights, if any, on how the current administration's reductions in our personnel and or funding will affect the veterans program?
So the question is, do we have any insight on how any changes in VA funding or personnel could affect things? We really don't. Now, what I will say is, dealing with big VA is kind of a wild card anyway. You can't guarantee a certain time frame for anything. A lot of it depends on when you apply, how many people are in the queue, how many people are working. From a claims perspective, I have not seen anything significant, happening, differently over the last several months. But it's also a little hard to say because things are so variable anyway. So no huge impacts at this point, but it could change. It kind of just depends on how many claims are submitted, who's available to handle this.
Okay, hey, how should we look at it? How do you find the right PSO? One that's not just from forms to fill this out. One that I look for that's going to be helpful, helping guide the process to be successful.
Yeah, see, see, you gotta go to her, she's very good, so, see, like the guy that could the process.
So
And I'm not saying that because we got two Navy neutral people here, that sponsor this. But I think when you're looking at it, it's the relationship between you and that PSO. So that's the bottom line. So if you get in there and you get the appointment and you don't get a warm and fuzzy, then go to someone else.
100%.
Because we are, and like I said, all of our organizations, we're the right price, right? $3.99.
Yeah.
And that's what you really want to look at. And as the regional director, I've had people, they say, I want to talk to your boss. Okay, they call me up and I'm like, I'm sorry, it didn't work out for you. How about this person?
Right.
And then they'll call me back and say, oh, this is wonderful. That's what they need. It's just that rapport, that comfort level, and particularly when you're having an intimate conversation with that person across from you. You should have that person feel very comfortable disclosing all of your ailments to. And not only that, you want to make sure that person does the thorough check, because if they're good, they will come up with things that you hadn't even thought about.
Exactly.
That are secondary to your primary condition.
Based on service. Like the woman who taught me, she was Army. She didn't know anything about AFFF. She didn't know anything about toxic things on ship. So that can help too. And I don't know how you feel about this, Heather. I would not file a claim online. I talked to somebody face to face as to advocate for you, because like he said, they know things that you don't even think of.
Yeah, I just wanted to file and just feel.
No.
Yeah. So
Secondary.
Oh, no, you should have to sit down. And in fact, after your first appointment, you should leave that appointment with homework.
Yes.
And they say, I need these things, so then you come back with a follow-up appointment. But what I also tell everybody, if you're going to file, the first thing is get off the phone with me and then go to that VA website and do the intent to file, because that starts your clock and that starts the payment from, so if the VA takes 2 years to adjudicate